Welcome to the Maine Track celebration for the class of 2021. I'm Jeff Sanders, the president at Maine Medical Center. It's my distinct honor to welcome you to this year's celebration. The Maine Track program has been in place for many years now. It serves so many important functions for Maine Medical Center, and for the students. I wanted to highlight some of the key things we hope to accomplish when we entered into this program, and we far exceeded them. First, we want to expand access to medical education for residents in the state of Maine. Two, we want to expand physician workforce in the state of Maine with a primary focus on primary care. And third, we wanted to expand our connection to the more rural parts of the state through the medical education process. We've done all three of those. We also wanted to make sure we could provide an affordable medical education for the students going through this program. We've done that by working with incredible benefactors throughout the state of Maine, foundations, corporations, individuals, and the state government. Every year we provide scholarship support to 20 students in the program for $22 million per year. Over the course of the program, we provided scholarship support to 244 students who have gone through this program, exceeding $21 million in scholarship support. I want to thank those who have contributed to this program to allow us to provide that scholarship support to the next generation of physicians. Without them, this program would not be possible. I also want to acknowledge the faculty here in Maine, the faculty down in Boston. That team works tirelessly to ensure we have the right curriculum and the right level of support. And it's been a unique period during your education that they've worked with you and made sure we ensure an incredible educational experience for the students going through this program. I also want to acknowledge the families. Congratulations. All your hard work has resulted in the next generation of physicians. Congratulations to you. Celebrate with the students who are beginning the next journey of their careers in medicine. And lastly, I wanted to do a great shout out to graduating medical students. Thank you for selecting the Maine Track program, for being with us here in Maine. A number of you, I believe 13, will stay with us through your training. Thank you for that. I wish you all nothing but the best in the next leg of your journey and throughout your career. Thank you for choosing medicine. It is one of the most rewarding careers, whether you do it as a physician or in roles like mine. Thank you, congratulations, and good luck to you.
Good morning, everyone. My name is Peter Bates, and it's my privilege to be the interim dean of the School of Medicine at Tufts. For those of you familiar with our school, you'll know I'm coming to you from the 8th floor of the Medical Education Building, and it's a pleasure to be here today. I really want to express two messages of gratitude, and then perhaps, if you'll permit me, a brief ask. The first is to Maine Medical Center, the state of Maine, and the faculty, staff, and donors that have made the Maine Track possible. It's an incredible accomplishment. In 13 years, you've graduated 9 classes of doctors, about 320 in all, and roughly 50% or more who are practicing in the state of Maine. It's really a credit to your commitment to medical education and the health of the citizens of the state of Maine, and I thank you for that. But I also want to speak personally to the graduates. I want to express my recognition and admiration for your resilience and professionalism while experiencing a pandemic through your 3rd and 4th year of medical school. Only you and your families know how challenging that is. And the way you conducted yourselves and showed compassion for your colleagues and for your patients and for your responsibilities as medical students was truly impressive. But even more than that, I want to commend you for the way you helped us steer through the recent challenges with racial injustice and our Sackler dilemma of a few years ago. You helped me and our school reset our moral compass. I want to thank you for that as well. Now may I ask, in a few short years, you're going to finish your education and training, and I hope you reflect on your time with the medical school and the state of Maine, and think about us when your future career plans come along. Again, congratulations, and thank you very much.
Good morning, everybody. Thanks for being with us. I'm Doug Sawyer, the local dean for our Maine Track program. self-titled Dean of the North. I want to welcome you to our celebration, and it's my honor to present the faculty awardees selected by the Maine track class of 21. I'll start by thanking all the faculty who have contributed to all the medical education necessary for these wonderful people to become physicians. We do have 5 specific awardees that we'd like to announce today. The first is the Robert S. Hillman Urban Teaching Award in honor of Dr. Robert Hillman's many years as Chief of Medicine at Maine Medical Center and his inspirational and lifelong commitment to medical education. This year's Robert S. Hillman Award goes to Andreas Tusen. Dr. Tusen is noted by students for his dedicated, passionate commitment to education and his kind, friendly, approachable manner. Congratulations, Dr. Tusen.
Hey everyone, Bean and I just wanted to put together this quick video to say congratulations to Dr. Tusen for winning a teaching award this year. Such a well-deserved honor. I know I personally had the chance to work with Dr. Tusen during my 3rd year medicine rotation and absolutely loved it. I think, Dr. Tusen, you have a particular ability of being able to identify where a student's at and then helping push them to the next level, whether that's with clinical knowledge or taking more and more responsibilities on in the clinical setting. So once again, overall, congratulations from both Bean and I and the rest of the class. Such a well-deserved honor, and thanks so much for working with us medical students over the past couple of years.
Thanks, Christian. The next award is the Roger A. Renfrew Rural Teaching Award in honor of Dr. Renfrew's commitment to clinical education in Skowhegan, Maine. And this year's Roger A. Renfrew Rural Teaching Award recipient is a Tufts Maine track graduate, Caleb Swanberg. Congratulations, Dr. Swanberg. He's known as a passionate educator, returning to his hometown of Caribou and participating in the committed education to our longitudinal integrated clerkship students in Caribou.
Hey, Dr. Swanberg, I just want to say thank you for the great family medicine experience in Caribou. I had a great time going on home visits and learning from all of your patients, and you deserve this award. Congratulations.
Thank you, Jacqueline. The next award is the Robert G. Bingyu Resident Teaching Award in honor of Dr. Bingyu's exemplary leadership and passion for innovation in medical education as a resident and faculty member at Maine Medical Center. And this year's Robert G. Bingyu Resident Teaching Award recipient is Margaret Wilkes. Dr. Wilkes is known for her commitment to education across the spectrum of the inpatient, outpatient, and OR settings, and we're honored to give her this award this year.
Congratulations, Margaret. I'll always remember your knowledge and kindness towards patients, and you always made me feel so welcome on the team.
Thank you, Street. The next award is the Peter W. Bates Fellow Teaching Award in honor of Dr. Bates' unwavering commitment to education and community as a fellow faculty member and Maine Medical Center's first chief academic officer. This year's Peter W. Bates Fellow Teaching Award goes to Dr. Ryan Best. Dr. Best is known as an energetic, kind, and approachable clinician educator who's done a great job working with our students as they go through critical care training. Congratulations, Dr. Best.
Hi, Ryan. I just wanted to say thanks for all the great teaching on ICU rounds and also for helping me successfully place the A-line on a patient. I know I speak for all my peers who worked with you as well, that you made working in the ICU much less intimidating and also a great space for learning. Congratulations, thanks again, and I hope to work with you again one day.
Thank you, Andrew. And this year we have a new award given to an advanced practice provider for their commitment to education of our medical students. And this year's recipient of the Advanced Practice Provider Award, Teaching Award, goes to Tony Imick, a nurse practitioner working in pediatric endocrinology, who's noted for her commitment to keeping things patient-centered and often a complicated setting. Congratulations, Tony, for this award.
Tony, congratulations on this award. You are the blueprint for a healthcare provider who is truly patient-centered. And on behalf of the class, thank you for taking such good care of your patients, for affirming them, for teaching them, and for allowing us to learn so much from you in the process. Congratulations.
I want to thank all the faculty again that have been participating and educating our students. And I want to turn the program over now to class president Spencer Stewart, who is the first Maine tracker to hold that title. Spencer, program is yours.
Good morning, everyone. My fellow Maine trackers, faculty, administration, family, and loved ones. My name is Spencer Scott. I am a fiercely proud Maine tracker. I am by looser standards a Mainer. I arrived here when I was 8 months old, not quite a true Mainer. And finally, through obvious errors in our online voting system, I am president of the class of 2021. Each year at this celebration on this day, a student is chosen by his or her peers in the graduating Maine track class to speak. And this year, it is no surprise who our class chose to address us today. And as president, I have this distinct honor of introducing this young woman. It would be, of course, preferable to hear her speak in person, to be in the live presence of her infectious energy and immutably positive spirit. But instead, as has been the norm for over a year, we will both join you from our respective Zoom studios. I know every member of the Maine track has a similar space, and I would venture to guess that most people watching this broadcast today have a similar space in their life, their Zoom room. These are the desks and rooms and corners of apartments from which we have conducted so much of our lives since the earliest days of the pandemic. And so this is mine. It's sparsely appointed, but there are some family photos on these walls behind me that I love to look at. On that wall there are 3 pictures of me and my brothers graduating from college. They went to Ivy League schools, and I didn't, simply on principle, and also I didn't get in. And then on the other wall here, there are some really great old photos of my mom, and my classmates might laugh here because I love to talk about my mom. But there's one portrait of her. It's from the 1960s, and she's in her nursing school uniform. Right after high school, she worked as a nurse until one day, a very dismissive intern on the wards disagreed with her clearly accurate clinical assessment. And so she decided on the spot, I can do what that guy does. And so she did. She went to medical school, and next to that photo is another photo of her reading an EKG in Boston City Hospital, where she trained in internal medicine in the 1970s. And I think I want to show you guys this photo. This is one of these pictures that you don't have to know it's the 1970s to know it's the 1970s. I mean, her glasses are like the size of salad plates, but I really love this photo. I cherish this photo. And when I look at these photos, I'm reminded of the context from which I come to this moment. And then I think of the diverse backgrounds and contexts from which we all in the Maine track arrive at this day of celebration. They are our myriad histories, our stories. And today we are going to hear from a classmate with an amazing story. And I think it is important that I point out that this classmate's story doesn't look or sound like mine does. And as far as medicine and surgery go, my story is perhaps somewhat uncomfortably a familiar one. If you leaf through the old textbooks, there are a lot of people who look like I do. They were men and they were white. And they were also seemingly obsessed with naming things after themselves. There's Beck's triad, there's Cushing's disease, there's Trousseau's sign. And my personal favorite is Meyer-Rokitansky-Kuster-Hauser syndrome. That is 4 names for one syndrome. Everybody wanted in on that one. And if you wanted to be a little more direct about this syndrome, you could also call it Mullerian duct agenesis, but then you're actually still referring to Dr. Mueller and the Mullerian duct. So really what we're talking about is paramesonephric duct agenesis. And I think that might be the best and simplest way to refer to it. And if any of my classmates just experienced some step 1 trauma palpitations, I apologize and I'm moving on. But when I think of these old and now familiar names from a bygone era of medicine, I try to be cognizant of the privilege my identity gives me, that I was, in essence, born on the right side of certain walls that exist in our profession and our society at large, walls which others have to break down just for the opportunity to realize their dreams. And they have always existed. When my mother went to BU School of Medicine, she was one of a handful of women in a medical school class of over 180 men. Today's speaker had to break down walls too. She is a woman, she is Black, she's the proud child of immigrants, And when I spoke to her about her own journey to and through medical school recently, she remarked, "I was never supposed to be here," meaning that her path was in no way predestined or even precedented, but she is exactly where she belongs. When I see our classmate, today's speaker, Asha Mohamud, I see a reflection of the true potential of our community. I see what is possible when we do the difficult work of dismantling these walls, both from within and without. And Asha, as you will hear today, is already hard at work. She is mentoring young people from her own community, being a living example of the success of which they deserve to dream and the greatness to which they, through her, can aspire. Any Maine tracker in the class of 2021 will tell you that Asha is a fierce advocate for her patients. Her capacity for empathy is limitless. And most importantly, she will bravely speak her mind when others fall quiet. Asha, I speak on behalf of all of your classmates when I tell you that it has been our privilege to spend the last 4 years alongside you. And I am so happy that I and others here today have the opportunity to continue to train with you here at Maine Medical Center for years still to come. So now it is my honor to introduce to you all an extraordinary young woman. She is our classmate, our friend, and today's chosen student speaker, Asha Mohamud.
Before I start, there's one human I need to address. 4 years ago, as Dean Bates welcomed our class into medicine, he mentioned we might gain a few wrinkles, age a bit. I turned to Hay and said, "Not with this skincare routine. We're gonna invest in eye cream, sis." At the time, did I know I was speaking to a future dermatologist? No. I am proud to announce that I'm still wrinkle-free. Lord knows I've grown 3 gray hairs, but my jobs are always popping, so I think I'm good. The world will never see my grays. When Dean Linder informed me I would be our class speaker, I did not know what to say. Honestly, I cried. I don't know what I did in this life to deserve this honor. In the same conversation, she told me it had been awesome to watch my progress, to see a quiet student grow out of her shell. You best believe I called my mom, my Hoyo, immediately and said, "Yo, Hoyo, you know there's humans in this life who genuinely believe I'm quiet." We both paused and giggled because anyone who knows me outside of medicine would never use the word quiet as an adjective to describe me. And before my family and friends go ham in the comments, I don't want to hear it. In this world, I hope to take after my father. He's a quiet man, a humble soul who has the ability to read the room beautifully. And when he speaks with intention and conviction. I've tried to follow in his footsteps these past 4 years. In reflecting on my journey, there are many days I think to myself, how on earth did you get here? For a long time, I called myself an atypical Maine tracker. I don't do the outdoors. You'll never catch me saying I enjoy hiking or skiing in the winter. It's just not cute. My hobbies are makeup, Netflix, and hanging out with my nephew Khalid. All jokes aside, I actually internalized that I was an atypical Maine tracker. For a while, I genuinely felt like I didn't belong. The baffling looks from my regular track classmates, medical teams, and patients when they asked me where I was from, and I would respond with Maine or Lewiston, just to be met with the dreaded, "But where are you from question. But Maine is home. So I became intentional about clarifying that dreaded question by repeating that I was a Mainer and that I was as Maine as it gets. I would immediately crack a joke by informing people that I did all of my schooling within a 2-mile radius, from elementary school all the way to Bates College. The state of Maine can't shake me. Mine is the story of a kid who was never supposed to become a physician. My family's journey in Maine started out in downtown Lewiston, sleeping on bare mattresses, trying to figure out how to survive in this new country we now call home. I have vivid memories of my mother working odd jobs to sustain her 3 young children. 3 kids, 3 pieces of luggage, in a poor mill town in Maine. My father would not join us for another 5 years. I have vivid memories of a younger version of myself struggling to grasp the English language. Along the way, there were countless voices telling me that my dreams were meant for others, expending years' worth of energy to tell me I would never make it into the main track program. I'm happy to say that my story is one of triumph, the underdog, the second Somali woman physician in the history of Maine. Throughout medical school, I realized I wasn't alone in my experiences. I saw so much of it echoed in my patient stories. Because of who I am, my race, my faith, my gender, my presence in medicine depends on the kindness and accommodation of others. So how dare I not extend that kindness to the patients I care for? As medical students, we recognize the power of listening. Although we couldn't push orders, we found that time was therapeutic. Validating pain in patients with substance use disorder was healing, and making medicine accessible to everyone was an essential aspect of our role on the teams. As doctors, we have the opportunity to dig deep and feel our patients' pain, to take their challenges as our own. We have to know our patients beyond their charts. We should be curious about another human's lived experience, not listening to reconcile their presentation with a suspected diagnosis, but listening as you would to a friend or a loved one. We interact with humanity in its most vulnerable state. This reminds me of a lesson my mother imparts on all of her children. Human beings only ever need you once, and how you treat them in their time of need will be how you are remembered forever. This lesson is amplified every day we care for patients. We have the privilege of hearing stories that have never once been told before, and in doing so, souls are unburdened. That is something strange about the human condition. Our sorrows become less painful when they're shared. There are certain voices which over centuries have persistently gone unheard. Much like the history of US policing and our justice system, our healthcare system suffers from racial injustice. Unequal access to care, education, housing, wealth, and employment opportunities perpetuate health disparities. By failing to hear these voices, we deny people their basic humanity. We read in horror about the stories of Henrietta Lacks and the Tuskegee experiment. We're forced to admit that the father of modern gynecology pioneered surgical techniques still used today by experimenting on enslaved Black women without anesthesia, without their consent. His justification? He did not believe Black bodies were capable of feeling pain. This notion, unbelievable as it is, still persists today. A 2016 study demonstrated 40% of residents and medical students surveyed believed Black people are not as sensitive to pain compared to their white counterparts and were less inclined to address their pain. I have seen these disparities with my own eyes. At one hospital, I recall seeing a case where a Black woman sat in an emergency room for hours, bleeding into her abdomen from a ruptured ectopic pregnancy. Her pain was unheard for hours. When she was finally seen, she had become unstable and her body had gone into shock. The truth is, this should have been treated as a surgical emergency the second she stepped foot into that hospital. So why wasn't she treated? The team didn't speak her language. She was cared for and ultimately did well, but this near miss could have resulted in permanent harm. This was not the fault of an individual human being, but of the system itself. So as physicians, we must be aware of the limitations of the systems we rely on. I encourage us all not to be intimidated by our patients who speak other languages. By taking the time to listen, you might save a life. I've witnessed the best of humanity among Maine trackers. The onset of COVID-19 quarantine was a terrifying time for many of us, but for Hea, it was a call to action. She made care packages for people experiencing homelessness. She made batches of hand sanitizer in her kitchen. Maine trackers volunteered their time to babysit the children of frontline workers. Many of you were also angry after the passing of George Floyd and made efforts to dismantle racism in medicine by educating yourselves. You formed a book club, hosted movie nights, and held discussions to discuss the intricacies of racism in the world that we live in. And you did this without taxing your colleagues of color. Abdimajid collaborated with local programs in Portland to create a curriculum for underserved and underrepresented elementary school students so that they can see themselves as doctors during their formative years. I also want to spend a few seconds highlighting that Abdimajid is going to be the first Somali surgeon in the history of the state of Maine. Cassie, Meg, Charm, and Bridget volunteer their time to teach high school students from underserved backgrounds as mentors in the Inside Medicine Club. Lindsay and Lizzie, among other Maine trackers, pushed for us to have a social media presence with the hopes to recruit all Mainers into our program. Dean Linder is the unsung hero in my story. She heard my fears and made my existence in the Maine Track program a non-negotiable. Over the years, she anticipated my needs without me ever having to verbalize them. A few weeks before our surgery rotation, we gathered in Brighton to learn the fundamentals of surgery. Fun fact, pig's feet, mimics human skin the most, and as a practicing Muslim, this could have easily presented a barrier. Before I could even advocate for myself, Dean Linder informed me that a station was already set up for me to practice on synthetic skin. Throughout my time in the Maine track, I've watched as classmates and faculty alike have come together to build a more equitable, inclusive infrastructure for future generations of underrepresented students. I wanted to highlight Dean Linder's leadership to demonstrate that what we can all do to alleviate the burden of underrepresented students when we're all in positions of power. Many of you will be on admissions committees one day, and I know you will all continue to champion racial diversity, equity, and inclusion. This is the Maine track. This is who we are. We cannot fix a problem if we do not know it exists. We have to educate ourselves actively. This is a pathology as real and as urgent as a heart attack or a stroke. We have the power and responsibility to save lives from the danger of racism, sexism, classism, and ableism. We must understand the disease process and its manifestation to recognize and treat it. We have to recognize that this is a human problem as much as it is a systemic one. Listen to people. As we know, listen to your patients long enough and they will tell you what's wrong and how to fix it. Challenge protocols. For our heart failure patients, for example, we prescribe Lasix, a water pill, without a second thought. We sometimes wonder why our patients are non-adherent to it, and it makes your bathroom trips more frequent. But it's not the end of the world, right? For patients who struggle with housing, this is an insurmountable hurdle. Our patients may struggle with mobility. So rather than labeling patients difficult, let us challenge ourselves to be curious about the barriers in our patients' lives so that we can be their best advocates. I have seen the Maine track rise to this challenge time and time again, and I'm so proud of this group of bright, talented physicians. I hope that each of you continue to empower marginalized and underserved communities. I want to extend my sincerest gratitude to my Maine track family for supporting me and never allowing me to feel like an atypical Maine tracker. I want to thank you all for always thinking critically and advocating for your patients. You are the kindest and most generous people I know, and I truly believe you have the ability to revolutionize medicine. My soul feels taken care of among you all. We've grown so much since our days on Cow Island. We have been in the trenches together and still found sincere ways to love one another. I want to thank our deans for always thinking one step ahead and challenging systems within Tufts to pave the way for students ahead of us. I have felt so loved and supported by all of our deans in both tracks, and I am eternally grateful to you all. I want to spend a moment to shout out our incredible class president for leading us through so much with grace and kindness. Spencer embodies all the values the Maine track holds dear. We salute you. But we would not be here without the support of our family and friends. These are the humans who weathered many storms on our behalf. They are the ones who believed in our dreams even when we could not. We made many sacrifices, and they made the same ones out of solidarity, and we are eternally grateful for your unconditional love and support over the years. This achievement is not just our own. It belongs to everyone who carried us through the trenches. I would not be standing here before you without the love of my family. I must speak to them directly. Know that your sacrifice was not in vain, and I love you all more than life itself. To the students I mentor, I am humbled to be in your lives, and thank you for giving my journey purpose. To my community, know that I will not be graduating on May 23rd. We will be graduating on May 23rd. To the Maine track class of 2021, I wish you bravery as we prepare to face the ever-changing field of medicine, knowing that we will forever be learning, curiosity as we seek to understand our patients, and compassion for our patients and for each other. It has been an honor to join you in this journey for the past 4 years. I cannot wait to see where your paths take you. Congratulations, class of 2021.
Asha, that was beautiful. Thank you for being the class speaker. And Spencer and Asha, listening to you both, I can see, I feel great comfort as well as confidence in the future of medicine at large, but also right here in Maine. It's now my pleasure to introduce the class selected speaker, Dr. Nirav Shah. Many of you know Dr. Shah as he's become a phenomenal presence here in the state of Maine. He joined his current role as director of Maine Center for Disease Control and Prevention in June of 2019, coming from director of Illinois Department of Public Health, where he implemented key initiatives to address the state's opioid crisis, reduce maternal and infant mortality, and reduce lead poisoning. As an attorney and public health economist, Dr. Shah previously advised professionals and governments around the nation and globe on improving the delivery of healthcare. Earlier in his career, he worked for the Ministry of Health in Cambodia, where his work included investigating and managing disease outbreaks as an epidemiologist. Dr. Shah received both his medical and law degrees from the University of Chicago and studied economics at Oxford University. Dr. Shah, thank you again for being with us today and helping us celebrate the Maine Track Class of 21.
Well, thank you so much, everyone. It is such an honor to be with you all, and especially on such an auspicious day. Let me first start by thanking Mackenzie O'Connor, Dr. Sawyer, and the entire Maine Track team for inviting me to join you on such a joyous celebration. Again, it is truly an honor. And let's start with the most important thing. Congratulations to each and every one of you for this rite of passage, for this next step in your career. Commencement addresses are supposed to follow something of a path. And I don't intend to stray from that too much, other than to try to be transparent about the path that I'm following. I'd like to do a couple of things today. The first is reflect a little bit on the year that you have all had on top of the 3 years before that comprising medical school. And then talk a little bit about what COVID has meant for the system of healthcare that you will soon be migrating into as further trainees and then eventually as attendings and clinicians. But really spend the bulk of the time asking you, challenging you to think about what it means for yourself. So let's first start by acknowledging that today is not at all what you thought it was going to be. You perhaps thought that your ceremony would be in an auditorium, there would be an air of celebration, there would be an electricity to it. And unfortunately, once again, we are all on Zoom, something we've all become accustomed to over the past year. Now, that just speaks to the sacrifices that each and every one of you has made in different ways, whether it's with your medical school education or with your social lives or the ways in which you've had to connect with your friends and family in alternative means. It's not easy to do, and we should be acknowledging that challenge. But you've also adapted to each and every one of those challenges, and that unto itself is a skill that we should not discount. Those challenges come on top of a year where you've done nothing but adapt. And in the process of those adaptations, you've earned yourself a front seat to seeing COVID-19 unfold in the ways that it has over the past year. Now, it would be really easy for all of us to just reflect over what's happened in the past year. And I do want to do that for a moment. But again, what I'd really like to spend some time talking about today is what it means for the future, what it means for your career. So let's talk first about the ways in which COVID-19 has affected public health and medicine, and then the ways that that will change and alter your careers. Now, some of the ways that we've seen COVID-19 affect the healthcare system are quite obvious. For example, the more robust use of telehealth, particularly in behavioral health situations. We've also seen rapid adaptation of things that honestly just a few years ago would have been crazy to even talk about, like drive-through testing. Who would have ever thought that people would be interested in sitting in their car and having a swab placed in their nose and then driving away and getting a lab result a couple days later? But there have also been ways that COVID has changed fundamentally the way we think about the healthcare system. For example, taking care of people at home has become the standard, even so much so that we now talk about hospitalizing people at home. There have also been somewhat hidden and unseen ways that COVID has affected the healthcare system. For example, using data in a rigorous fashion at the system level and at the state level to figure out who should get vaccinated first, and then using those data to actually reach out to people. We talk a good game sometimes in healthcare about being data-driven, but it's not too often that we actually use those data to drive what we're doing on a day-to-day basis. Throughout COVID, we've built a new set of muscles, and we're now actually using that musculature to do new and different things at a large scale. Some of this has been precipitated by cultural shifts. People trust care outside of the clinic now and come to see that care as being high quality, whether it's a diagnostic test that you get in a parking lot or a vaccine that you get at a school gym. We now have a sense that good quality care can be uncoupled from the office and maybe even from the actual hospital. But COVID-19 and the shared experience that it has generated has also uncovered wounds that were already there and made them very clear for everyone to see. For example, health disparities, a word that we in public health and healthcare use, have now been made and laid bare for all across the country to see. Whether it's differential rates of disease, access to care, as Asha spoke about, challenges from a linguistic and cultural sense, as well as just everyday things that those of us in medicine knew were around, like being able to have paid time off or being able to have transportation to access care. Those are now findings and phenomena that are evident to everybody across the country. So we now have an opportunity as a state, as a country, to reboot healthcare at a time when everyone is behind it. The question is, what will we do with that? Now, that's a policy question that I'm not going to dwell upon because that conversation is going to happen over the next weeks, over the next months, over the next years. What I want to talk about is what it means for you. What will your role in this post-COVID healthcare system, this post-COVID healthcare architecture be? You may decide that your appropriate level of engagement in the post-COVID system of care is to be first and foremost and 100% a clinician. And there is nothing wrong with that. But I think we all owe it to ourselves to have a conversation with each other and internally about what COVID means from a societal obligation perspective. So, for example, you are going to be moving into your next stage of medicine, of your medical career, at a time when, in the minds of the public, public health and medicine are one and the same. So the question I have for you all today is, where do you want to engage? Now, again, perhaps your boundary will be just at the level of being a clinician. But what if, for example, a 33-year-old woman who comes into your clinic, who's a mom of two, and who's working a job where she has no control over her schedule, comes in and is seeking care, and you realize in interviewing her that she works 3 jobs. She's having difficulty feeding her family. She has no reliable access to transportation, and she doesn't feel safe at home. And the proximate reason why she is coming in is for management of her hypertension. But what about all of those other problems that are in her lives? Problems that are contributing to, if not outright exacerbating, the thing that she's come into you to see. How much of those problems is it your obligation to tackle? Will you tackle them? Will you sit down and take the extra time to ask her what to do about not feeling safe at home? Will you sit down and work with her to enroll in Medicaid, as well as SNAP benefits so she can get her family fed? Will you take the time to work with her to help her understand how and when she can access transportation? Maybe, maybe not, but you've got a question in front of you about what your level of advocacy and engagement will be. Now let's say you decide that you do want to go down all of those pathways, addressing her social determinants of health. Do you have an obligation to take the next step? Do you have an obligation to join with colleagues across policy lines to go down to Augusta or to Washington, D.C. to advocate for paid time off, to advocate for broader access to Medicaid? Do you have an obligation to do those things? In the future of a post-COVID world, questions of proximate healthcare will be they will be one and the same with questions of public health and the social determinants of health. And each and every one of you is every single morning going to have to wake up and ask yourself, how engaged do you want to be? And at what levels of engagement do you want to be? Now, for some of you, the right level of engagement will be to stick with the thing that the patient comes in to talk about. We call it their chief complaint in medicine. For others of you, you will be compelled to peel back the onion one layer further and not just go to their chief complaint, but ask what's driving those complaints. Why does this patient have uncontrolled hypertension? Why is it that the medication I've prescribed is not getting the job done? And for others of you, you will find it most appropriate to peel back the onion one layer further and say, what are the changes that I can make in my community that will address not just my patient's underlying social determinants, but my entire community's social determinants? And for some of you even further, you will want to go yet to the next layer of that onion and say, what changes can be made at a policy, a systemic level, to make sure that my colleagues don't even have to deal with this again in the future? That is the position I found myself in 20 plus years ago when I was in medical school. My colleagues and I, my classmates, all of us back at the day, we all got complimentary subscriptions to the New England Journal of Medicine. And if you can believe it, we had these things called mailboxes where a physical magazine would be delivered to us every week. And it was comprised of paper that was bound and it would be placed in our mailbox. It was completely crazy. And all of my classmates and I would go as soon as the New England Journal was dropped off. And they would all rush to the case report from the Massachusetts General Hospital. And we all had a competition to see who could figure out what was going on, what the ultimate diagnosis was, only after reading the first introductory line of the case report from the Massachusetts General Hospital. And that was how we amused ourselves. I went to a not so fun medical school. But I always thought that what was interesting was not the case report from the Massachusetts General Hospital, but rather the newest report on healthcare policy. Because I wasn't so interested in the patient who was coming into the door. I was interested in the 9,999 patients who didn't even make it to the door, who didn't even make it to clinic. What could we do to address the healthcare problems that we knew that they had, but just never were seeing? Now, my ask of each of you is that in this post-COVID world, with telemedicine being a new thing and new modalities of care, whether it's in the parking lot or at home or everywhere in between, becoming the standard, and opportunities to experiment becoming the norm, my ask for each of you is to ask yourselves, what do I want to do beyond the patient office, beyond the doctor's office, beyond the bedroom at the hospital where my patient is being hospitalized? What's the right level of care and engagement that I should be bringing to the healthcare system? For some of you, it will be just that, one-on-one patient care. But for others of you, in a post-COVID world of healthcare, the sky is literally the limit. And you may not have an obligation to hike down to Augusta or DC every week, but you at least have an obligation to ask yourselves what more you can be doing in the future. Now, the other thing that any type of rite of passage speech must include is one piece of advice. Now, many of you, even today, between Spencer and Asha, have spoken of mentors that you had that got you here. I have one rule in my life. Well, I have a lot of rules. Don't eat gas station sushi, always try to be nice to people, so on and so forth. I've got a lot of rules. But one of the rules that I take very seriously is always in life to have a mentor and a mentee. Many of you are now at the stage, you already have a mentor, but you now have to figure out how you're going to pay it forward. Who is your mentee? If you don't have somebody in your life right now that you look up to, and then someone you help come up on the ladder to come up on that next rung, now is the time. Now is the time to go out and find somebody who you can help, as well as figure out who are those people who are going to help you at that next stage. And the final piece of advice that I am by law required to oblige and pass on is when you think about those who you are seeking advice from, your mentors, as well as those who you are giving advice to, your mentees, I ask that you do one thing. Always bear in mind what we call confirmation bias, the tendency to tell folks that the right course of action is the course of action that you took. I've seen it throughout my life with mentors that I've gone to. It's almost kind of comical. You can almost predict the advice that someone is going to give to you based on exactly what their CV is, because most people have a tendency to tell you that the right thing to do is the thing that they did. I'd ask you to think about that differently. When you are giving advice to folks, which I strongly encourage you to be involved with, as Asha noted, always start the conversation by asking them what they want to do. And similarly, when you are seeking advice from your mentors, if your mentor is not starting that conversation with, what do you want to do? Well, that's a sign that you want to be advocating perhaps for a different mentor. So with that, I am so honored to be able to join you for these few short minutes. I hope to be able to meet and work with many of you, certainly those who are going to be staying in Maine over the next couple of years, over the next couple of decades. And for those of you who are going to be pursuing elsewhere, I hope you come back to Maine. I have loved nothing more than our time in Maine thus far. My family and I have been so happy ever since we moved here. And as Asha noted, and as Spencer noted as well, Maine has been so welcoming, and I am so glad to be here. I'm also so glad to be able to join you all and congratulate you on this milestone. Congratulations to each of every one of you. All the best on your future careers, and I hope our paths cross this soon. Thank you all.
Thank you, Dr. Shah. Your leadership during these unprecedented times continues to inspire us and keep us grounded. Thank you so much for being here. Hello, everyone. I am Jo Linder, Assistant Dean for Students. Thank you, Asha, for the shout out. I have the honor and privilege of getting to know each of these creative, talented, caring students who will soon be physicians. And as you've heard, they truly will change the world. Instead of cheering them, as we usually do, where they walk across a stage, the students will give their own creative, unique introductions. And so now, here is the Maine Track class of 2021.
Jasper Abdraber, Natick, Massachusetts, UVM Internal Medicine.
Catherine Stearns Badger, Jackson, New Hampshire, then Portland, Maine, Family Medicine at Maine Dartmouth.
Louisa Bauer, Bedford, Massachusetts, Internal Medicine at Maine Medical Center.
Andrew Beauchesne, Camden, Maine, Diagnostic Radiology at Beth Israel Deaconess Medical Center.
My name is Campbell Weil Haley. I'm from Yarmouth, Maine, and I will be studying emergency medicine at UC Irvine.
Becca Bell, Yarmouth, Maine, Dartmouth Otolaryngology.
Sarah Brockett, Randolph, New Hampshire, Radiology at Maine Medical Center.
Addie Brown, Golden, Colorado, Internal Medicine at the University of Utah.
Sarah Bunting, Scarborough, Maine, Emergency Medicine at Maine Medical Center.
Corinne Carland, Internal Medicine at the University of Pennsylvania.
Brandon Cushman from Gorham, Maine, Orthopedics at the University of Vermont.
Elizabeth Fishman, Yarmouth, Maine, Pediatrics at New York Presbyterian, Columbia.
Rachel Henderson, Hamden, Maine, Psychiatry at Maine Medical Center.
Alex Jones, Madbury, New Hampshire, Internal Medicine at UT Southwestern.
Cham Karunasari, Caribou, Maine, Anesthesiology at Maine Medical Center.
Austri Kempinen, Shazy, New York,
Family Medicine at University of Vermont.
Rachel Kritchmar, Facein, Vermont, Emergency Medicine at Duke University.
Meg Krutoff, Biddeford Pool, Maine, Internal Medicine at the University of Rochester.
Hannah Martin, Yarmouth, Maine, Pediatrics at Jefferson DuPont.
Asha Mohamud, Lewiston, Maine, Internal Medicine at Maine Medical Center.
Grace Mueller, Edwardsville, Illinois, Psychiatry at Maine Medical Center.
Lindsay Newton, Concord, Massachusetts, Anesthesiology at the University of Michigan.
Bridget Olson, Elliott, Maine, General Surgery at Maine Medical Center.
Tad Olson, Elliott, Maine, Internal Medicine at Maine Medical Center.
Jackie O'Sullivan, Weymouth, Massachusetts, OBGYN at Danbury Hospital in Connecticut.
Julian Oviedo, Fair Oaks Ranch, Texas, Diagnostic Radiology, Leahy Clinic.
Catherine Potter from Durham, New Hampshire, OBGYN at Maine Medical Center.
Sheila Rajan, Orrington, Maine, Internal Medicine at Leahy Hospital and Medical Center.
Kent Reichel, Hamden, Maine, Interventional Radiology at Johns Hopkins.
Calvin Robbins, Waldoboro, Maine, Ophthalmology at Henry Ford.
My name is Jackie Royal. I'm from Ellsworth, Maine, and I'm matched in Family Medicine at Maine Medical Center.
Spencer Scott, Cape Elizabeth, Maine, General Surgery at Maine Medical Center.
Christian Sleeper, Caribou, Maine, Integrated Interventional and Diagnostic Radiology at the University of Michigan.
Alex Smith, Whitefield, Maine, Internal Medicine at Maine Medical Center.
Cassie Stanzler, Ann Arbor, Michigan, Family Medicine at the University of Cincinnati Christ Hospital.
Katie Ward, Dedham, Maine, General Surgery at Beaumont Royal Oak.
What a class, what a class. Well, in closing today's celebration, I want to thank each and every one of the family and members and friends for all the support you've given these newly minted doctors over their lives during their time in med school, and of course, beyond med school as they go out into the next phase of their training. We share your pride in them as well as their gratitude to you for all the help you've given them in their journey. On behalf of the program, I also want to thank all of our faculty and staff in the hospitals and clinics across Maine who have helped these students with their education as an essential ingredient in the complicated recipe of making a great physician who understands the art and science of practicing medicine. I want to echo the thanks of Jess Sanders and Dean Bates to each and every one of the generous individuals and organizations, as well as the state of Maine, for the investment that's been made in our scholarship programs, providing a way to help us reduce the cost of medical education for our students. On behalf of all who have been able to join the celebration, I give a special thanks to Dr. Nirav Shah for taking the time to be with us today and participating in our celebration. We know how busy you are and how tirelessly you've worked for the health and safety of our state. You've been an inspiration and as a physician leader for our state in a difficult time, and your presence today in words and challenges provide great meaning to all of our graduates and us all. Many thanks to our talented team who put this celebration together despite the challenges and made it a success. I specifically want to call out Dean Linder, Dr. Carl Germain, Maine Track Representatives Becca Bell and Bridget Olson, and behind the scenes are very talented Mackenzie O'Connor and Ashley Plowman, along with communications wizard Carolyn Cornish, and our development team, Caitlin Dersiminian, Tara Studley, and John Curran, who've made this a success. Finally, I want to congratulate you, Tufts Maine Track Class of 2021, and thank you. Congratulations on successfully completing your medical degrees. Thank you for all you've done to help the patients you've met and worked with as students. Thank you also for all you've done for our communities and for us as an organization. And specifically, thank you for navigating your way so gracefully through the many challenges and stressors that have made your educational experience unpredictably unique. On behalf of the Tufts Maine Track Administration faculty, we're grateful to have worked with you. We're proud of the physicians you have become and inspired by your commitment to your profession. This completes the public YouTube component of the program. Just after a toast from Becca Bell and Bridget Olson, we thank you for joining us. For those on Zoom, please stay on after the toast for continued celebration.
To our class, so witty and wise, there's simply no way to summarize how much we have learned as the late candle burned. Couldn't have made it without all of you guys.
We would also like to express that you're all just simply the best. Spence made us laugh, and we fit the most on the raft. The others have been very impressed.
It's been fun to watch you all grow through all of our med school woes. Some of us have wed and others dog fed, and most of us skied in the snow.
Now we're psyched to see what you'll do. In your medical training, part 2, you'll take care of babies and old men and ladies while keeping your values in view.
You've mastered the 5 causes of shock and learned how to pronounce wanky bach. You're all wicked smart and will practice with heart. I'd feel safe if you were my doc.
So now we must go on our way, although 14 of you get to stay. But please save us a spot, because like it or not, we'll all be back here one day.